You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have Dr. David Porter. Dr. Porter, welcome to the program.
Thank you. Nice to meet you.
So you brought some photos, so we'll get to as many of those as possible. But for people that don't know your practice, like who's the typical dental implant patient?
Well, Randy, we typically have two types of patients that are coming in for dental implants. The first group of patients are people that are losing their teeth, or they know that they're going to lose their teeth. They have broken teeth, bleeding gums, bad breath, all sorts of types of things like that. And then people that typically have dentures already, who are just really never happy or satisfied with those, and they want something that's just more stable so they can live their life the way they want.
Okay, good. Now you have kind of a holistic, I'm calling it a holistic practice, but you do a lot of things naturally, like trying to avoid antibiotics or materials that are toxic.
Yeah.
Tell me about that.
Yeah, well, I'm also a board-certified naturopathic physician.
Okay.
And so we're always just looking for things that are more natural or more holistic for the patient. We take the whole body or the whole holistic approach in mind when we're treating the teeth and the gums, because really everything is attached. And so we can't do anything in the mouth without having an effect on the body.
Now your center, I guess, how dental implants are normally done across the country is you go to one place, like the oral surgeon that does the implant, you go to another doctor that puts a tooth on top, and then another place for the imaging. You do it all right there.
Absolutely. We take care of everything right in our office. And so it just cuts out a lot of the middlemen. And so we're able to go from start to finish, transitioning from no teeth to teeth.
Right away.
Right away, absolutely.
So you think this is like the future of dentistry, like no more dentures, like we said at the top of the show, or bridges or partials? That means implants will be like the standard of care?
Absolutely, it will be. Those things that you mentioned, bridges, dentures, I think those are falling by the wayside. Implants are really going to revolutionize dentistry and continue to do so as more people become aware of them.
Okay, good. Now, in your area,
yes,
are there a lot of people wearing like an upper or lower denture?
Yes,
where you are?
Absolutely. Lots of people in my area, and if you look at the statistics from around the country, 40 million people are estimated to have an upper or lower denture.
Okay.
So if you think about that, Mile High Stadium, that's enough to fill up Mile High Stadium 500 times. In our community, locally, lots of people that
thousands of people,
thousands, tens of thousands of people in our community that have an upper or lower denture.
So if there's so many people either wearing dentures or headed for dentures, why aren't they all coming in to do it? What's your take?
That's a great question. So I've thought about this for a while, and so there's a number of reasons why people don't have dental implants or don't know about dental implants. The first reason is because if you have dentures, you typically don't go to the dental office.
Okay.
And so you're just really not in the system. And if you've had dentures, then you typically had a very maybe not a good association with dentistry in general. And so people come in that have dentures. The only reason why they come in is because they need a reline, they get their denture adjusted, they have sore spots, the denture doesn't fit the same way. And so they kind of feel like they're being kind of nickel and dimed to death almost.
Okay.
The second reason is because if you do have dentures, your life as a denture wearer or as somebody that's transitioned there hasn't been very fun. It's not that these people don't want to be healthy. They've spent thousands and thousands of dollars trying to keep their natural teeth. They've went to get fillings. They've tried to deal with the gum disease, the bacteria, the infections. They've transitioned to from fillings to crowns to root canals, back to getting crowns redone. It's not that these people don't want to have a healthy mouth, it's just they've been fighting it their whole life. So by the end of it, when somebody tells them that they have to go with dentures, honestly, it's a relief. And so they get the teeth out, and like I said, for them, it's a relief. It's over.
Done. So the last thing they want to do is see you.
Absolutely.
Again.
Absolutely. The third reason is just because money. People are just unaware of what dental implants can do and what advantages they have. A lot of people think that maybe you have to get an implant for every single tooth you lose, and that's just not the case. So oftentimes you can do 2, maybe 4, or even 6 implants, and you can replace an entire arch.
All right.
So another reason that people typically have is fear. They just don't understand what's involved with dental implants.
Does it hurt? I mean, it seems like a very painful
Actually, it isn't. So I have a story there. So I have a friend of mine who came in and she needed 4 dental implants. And so she suffers from a condition to where if she's under a lot of stress, she can have seizures. And so we agreed that she was going to just do 1 dental implant per time, and we were going to space this out over a course of a year or 2. So she comes in, we do the dental implant. I call her the next day to see how she's feeling. She's all, I want to schedule the other 3.
Okay.
So, like I said before, dental
And
implants.
they're numbed up.
Absolutely, they're
during-
numbed completely, but
Like some sort of sedation?
absolutely, you can do a number of different types of sedation, or a lot of people just choose not to be, especially after that first one, and when they're able to kind of see and experience what it is like. If you've had a root canal or an extraction or even a crown, an implant is much easier than any one of those.
Okay. Now, how old can you be to do this? Like if a denture wearer is watching this, how old to get a new set of
100
teeth?
years old.
Really?
Absolutely.
Statistically, there's like somebody older is not more likely to come out?
Absolutely not. And so you can do implants, and we see this in our office where people are in their 90s, 90 plus, getting implants taken. And it's because they want the ability to chew their food. That's something that I think you and I and most people take for granted, is the
Okay,
ability
that's fair.
to chew our food. We're oftentimes told by our physician friends that, we need to eat a well-balanced diet. Well, that's almost impossible to do if you have a denture. Okay, so our ability to chew and our food is important to our overall nutrition and really our overall health.
So after you get a new set of teeth supported by dental implants, how soon could you eat? I mean, if everything goes well.
If everything goes well and you have the right support and the right mechanics and everything, actually the same day.
Is that right?
Absolutely.
Do they call you and tell you what they're eating?
Absolutely. Peanut brittle, apples, carrots, all those things that they really have not been able to eat for years and years and years. You would be surprised at the dramatic impact this has on somebody's life.
So you brought some photos. What are we looking at?
Okay. Well, this is Gary. And as you can see, Gary, that's his natural smile there. He's just lost the ability or the confidence or even the know-how to smile naturally. He's got worn, broken down teeth. He's not happy about it. He's not happy how he when he looks in the mirror or how he reflects himself to other people.
Okay.
So the options that Gary has is a couple options. Is that we can fix all of his teeth. He's still got good bone support, good periodontal health, and so we can fix those teeth. Or his options that he's been given at some other places has been dentures because his teeth are so broken down. So we went over to Gary with overall his options.
So he doesn't want dentures, obviously.
He does not want dentures,
Okay.
and he's fortunate enough to be able to find us in time to not need dentures.
Okay.
And so we're able to restore all of his teeth, and you can see that the after.
Let's take a look.
There we go. So there's.
Wow. Very nice.
So you can see here that the before and after is dramatic, to say the least. This is not rehearsed, not trained. This is just his natural smile after we're able to put in these teeth. We've at least taken 10 years off him. I'd probably argue more.
Yeah, he looks younger. No
Absolutely.
doubt about it.
Yeah. And so we customize this smile like we do all of our patients for Gary, based off of his age, based off of the shape of his face, based off of what his desires were. And you can see the results are remarkable.
Now you say women and men have different teeth.
Absolutely.
How so? You say there's feminine teeth, masculine teeth.
There's feminine teeth, there's masculine teeth, there's teeth that you want to put in for somebody that has a different shaped face. So the goal of this is for me at least, is for when somebody sees this, they're going to look that you have beautiful teeth. Not that you have beautiful veneers or beautiful crowns. These need to look natural, and so they got to be done in a way that's going to reflect the personality of the person that they're with.
Okay, good. Now back to the denture wearers just for a moment.
Yeah.
So if you've been wearing a denture like 20 years or 10 plus years, is it true you don't have enough bone to do this?
That's actually not the case. So sometimes you'll go and get a referral from another physician, and they'll oftentimes tell you that, and that's based off of their experience or their imaging capability. What we've found at our office is that those instances are few and far between, and we've been able to help lots of people in cases where they've been already told that they don't have enough bone.
So if you, have you ever had to turn anybody away saying that we can't do it?
We have not.
Okay. So it's not an issue.
It is really not an issue. Like I said, it depends on the quality of your imaging, the experience that you have, but we have been fortunate enough that we have not had to turn anybody away because they didn't have enough bone support.
So what if you have bad gums? Can you still get dental implants?
Absolutely, you can still get dental implants.
Like even with gum disease?
Even with gum disease. So what we do in our office is our goal is to eliminate the gum disease before we move forward with the implants.
Okay.
So we do a number of different things to eliminate the gum disease. Obviously, we have a laser in our office that we can use to eliminate the bacteria. We use ozone, something that we don't like using.
Ozone?
Ozone, yes. So something that if we can help from using in our office is antibiotics. Antibiotics really kill the bacteria in our stomach and everywhere else in our body.
Okay.
So we can go in naturally and inject ozonated water,
disinfects the
ozone
area?
gas, and it completely disinfects the area completely naturally. So after the bacteria is taken care of, we can place and make dental implants stable in the bone.
Okay. And so with these people with that gum disease, you remove the teeth and the gum disease goes away.
Absolutely.
And they get nice, healthy gums.
They get nice and healthy gums. And so I have this one lady where she came in, she had broken teeth. We couldn't save the teeth just because they were bleeding gums, periodontal disease, severe infections. We're able to eliminate the infection using ozone, using the laser, making her teeth nice, or her gums nice and healthy. And we're able to place 2 implants in and have a snap-in denture because that's what she wanted. And it's been really life-changing for her ability to eat and chew peanut brittle, apples, carrots, things like that, things that
Nice.
she hasn't been able to chew in a long time, has really made her quality of life better.
So at the top of the show, you said there's 2 categories of the implant patients. Those people headed to dentures, they don't want dentures though, and then the people that are currently wearing dentures. So if they go to your practice, what are their options when it comes to dental implants?
So they have a few options. The initial option is to place 2 implants on the lower and have a snap-in or snap-out denture. Now that works for some people. For the people that have enough bone support, we can do that. With 2 implants, there is some maintenance involved in that. You have rings and things that do need maintenance and will need to be replaced, but it's far better than if you had no implants at all.
So no more adhesive. With just 2 implants, get a full arch of teeth that just kind of lock in?
Absolutely, yeah. No more adhesives. You can say goodbye to adhesives. So for people that are wanting a little bit more security, because 2 implants will still have a little bit of movement, not nearly like you did before. So the next option is you can do 4 implants, a full arch of teeth that's going to set in there and lock on to those 4 implants. A lot less mobility in there. You still do have some maintenance that is required with 4 implants. And then on the top, you can do the same thing. The nice thing about doing 4 implants on the top is you can remove the palate. If you didn't know this, there's taste buds in the roof of your mouth. And so when you are able to remove the palate of your old denture, food's going to even taste better. So for those options, those work for a lot of people. And then you also have the option to do 6 implants on the bottom and or the top, and you can have a fixed full set of arch of teeth. None of them come in and out. They're fixed in, non-removable, no maintenance at all.
Is that what everybody wants?
That is what everybody wants.
And they can eat what?
They can eat anything that they want. They can eat steak, potatoes, carrots, apples, peanut brittle, as we said.
Can they bite with their front teeth?
Yes, they can eat.
Like a carrot
Yes,
raw?
salads. They can eat salads, and there's not going to be anything that moves or wiggles or anything from their teeth.
Now I know a couple of denture wearers. They never seem to complain.
Well, they don't.
Are you saying there's no such thing as a happy or denture wearer?
That's what I'm saying. They don't complain to you because you're not their dentist, Randy.
Okay.
The life of a denture wearer is a tough one. For example, if you think about all the things that we do to relate to our family and friends, all involves food. Okay. Well, if you wear a denture, you pick things from the menu that you can and can't eat. So you're very limited. You have to make sure that if something gets caught underneath your denture, you've got to go to the restroom, you've got to wash it and clean it. And so you're really missing these moments in life. And these are the moments that we all remember, family reunions.
So they avoid these. Do they tell you that?
Absolutely, they do avoid them. They're embarrassed. They can't be themselves because they know they want to avoid these situations where they could be embarrassed. If you think about, people in their 50s and 60s and 70s are dating now, and so you're dating and you're trying to...
And you have a denture.
You have a denture and you're not really wanting anybody to know. So your life revolves around, when am I going to clean this? When am I going to take this out? Do I wear this to bed? I know I shouldn't. My dentist tells me I shouldn't wear this to bed, but I don't want anybody to know that I have a denture. And I've experienced this in my office where people refuse to take their denture out because they're embarrassed about somebody seeing them without it.
Yeah. Now, you told me, and I'm not laughing, I'm just saying it's interesting, that there are husband and wives, or people married that 20 years, and they claim that their spouse doesn't know they're wearing a denture.
Absolutely.
Is that
They've
right?
never taken it out in front of their spouse or their loved ones because they are just horrified at the image of themselves with these dentures out of their mouths. They look in the mirror and they see what that looks like, and they don't like that appearance at all. And so their worst fear of all is somebody seeing them without that denture. So there's a lot of foods that denture wearers struggle with. Salads are one, biting something with the ends of your teeth. Sandwiches, that you can't bite and pull anything away.
Good point.
And
yeah,
so
interesting.
people that have dentures have to avoid all these different types of food. And when you think about all these different things that we do as a community, as a family, all of those revolve around food. And so you end up directing your life based off of what you can and can't eat, and you're really missing out on lots of memories.
So with dental implants, okay. So is the future of dentistry, where maybe it's 20 years or 50 years, like dentures as we know them today will be eliminated? Do you believe that? Like they'll all be attached to implants or something?
Absolutely, yes. That is really a thing of the past. And so in the future, everything that you place in the mouth will be attached to something.
Okay, do you think you can wipe that out in Wyoming? No more dentures in Wyoming?
That's our goal at Synergy Dental, is to wipe or eliminate that.
Is that right?
Absolutely.
Now you're a dentist, so you probably think like the teeth are the most important thing.
Well, maybe not the most important thing, but certainly one of the most important things.
Okay.
Even if you remove me as a dentist from the equation, if you just look at surveys, right? Muscle and Fitness did a survey going over thousands of Americans of what do you think is the most attractive thing in another person. You would think Muscle and Fitness, that's going to be six-pack abs or tight buns, but number one came in as smile.
Yeah, okay.
American Academy of Cosmetic Dentistry did a survey, and it stated that 75% of the people surveyed had made a judgment of socioeconomic status based off of a person's smile. So
Okay.
that's really how important it is.
You brought up a good point about the movies. It's like if you want to make somebody look poor, you say.
Yes, you change their teeth. You're going to maybe take a tooth out, bring a tooth forward or back. You're going to change that smile. And so if you look at all the magazines, all the movies, they are promoting people with nice smile. That's what reflects on either the movie or on the product that they're selling, is that person on the cover of the magazine with their smiles.
And one of the things you say is that you give somebody with bad teeth a new smile, and they even act and look different.
Absolutely.
Really?
Absolutely, 100%. So I can give you a few examples of that, of just my own experience. And so I have a patient in the office who's been coming to see me for a number of years, and we've kind of talked about her worn teeth there a little bit. And she's been very dismissive about, doing something about that. And so over the course of time, we're able to just actually fix them with just some white composite material on the front of her teeth. And after we got done, it took us about 20 minutes, tears starting to come from her eyes. It made a huge difference to her to just be able to fix those teeth. I had another gentleman where we did 4 veneers on his front teeth. He comes back to me on his recare visit. I asked him, well, how things are going? And he said, honestly, and I'm quoting here, Randy, that I can't keep my wife's hands off of me any longer, okay? So,
Good.
and then I've got a personal experience. It's just my own daughter. She's a senior this year in high school. She's never been happy with her smile. And so I wanted to, as a gift to her, fix it for her. So we did 8 veneers for her, and she works in my office during the summer. And so
Okay.
the girls around came up to me and said, have you, noticed Alisa? Her personality is just beaming. She's a different person. And if you know my daughter, she's got a very open personality anyway. And so I've been able to see personally of what really a smile can do to somebody and their personality.
It might be like anything else. I mean, if you don't like something about yourself, it might hold you back.
Absolutely. When you walk into a room, if you don't like your nose, you think that everybody's looking at your nose when you walk in that room. When you walk in and you're not happy with your smile, either you're going to hide it because you think that everybody's looking at it. So we today have the power to change things that we don't like. And one thing that we can change is our smile, and we can make a big, big difference in
You
somebody's
say
life.
a smile could change your life.
Absolutely.
Is that an exaggeration?
Not at all. We've seen it change people's lives. For example, as I just said, my daughter, it's changed her life. It's changed people's lives. People have gotten job promotions. Because of
their confidence.
Absolutely. Their confidence exudes. They're actually able to smile more, communicate better, present themselves just in a different way, which really makes a big difference in their personal and their professional lives.
Okay, good. So no more dentures.
No more dentures.
No more dentures. Okay, you brought some more photos. What else are we looking at here?
So this is Tony, and he doesn't like a smile. He does not like the front tooth there in the front. It's an old porcelain fused metal crown. It's got a metal collar, black collar around the edge, and he's just not happy. He's noticed over the years that his teeth have just gotten shorter and shorter and shorter, which makes him look older and older and older. Tony's still a pretty young guy, so we are able to go in there and fix his teeth, give him a new set of upper teeth and lower teeth. So you can see here in the after photo.
Looks good?
Absolutely. Tony's teeth follows that lower lip there, okay? His teeth are the appropriate length now for his age. He looks younger. He looks happier, okay? The points on the canines, which signifies youth. Okay, so when you see these subtle little changes, as I said before, we customize everybody's smile for them based off of what they want, based off of how they look, what their goals are.
Okay, good. Now, if somebody's watching this right now and they're wearing a denture or they need a full mouth of extractions because you can't save their teeth, if everything works out, they're watching now, next month, could they have a brand new set of teeth?
Absolutely. Yes.
That don't come out even?
Absolutely. They can be fixed in permanently with implants where they won't come in and out, and you can get just as dramatic as results as we see in these pictures here.
Now with the snap-in, snap-out set of teeth, they could still eat like most things. I know we talked about it earlier, but could they eat like a pizza?
Absolutely, yes.
Okay.
They don't really have any restrictions on what they can eat. It just depends on what support system is going to fit best for them. But any of those options are a significant upgrade to having a denture, as we mentioned before.
So when they see their, like a guy like this, they see their self in the mirror for the first time, they get excited?
Oh, absolutely. You can tell. A lot of times you'll see tears coming from the eyes, but you can certainly see a dramatic result just in their personality. Sometimes it's instantaneous. Sometimes it takes a little while because of the shock of what they're seeing.
Like they're shocked on day one.
They're shocked on day one. They can't believe it. And so sometimes they'll come back to us and bring gifts and hugs, and we'll take pictures, and it's a very fun event.
Okay, good. You brought more photos.
Absolutely. So this is Tara. She's not happy with her smile. She's not happy with the color of her teeth. She's not happy with the flatness of her teeth. She stated that it makes her look old.
Okay.
So she's not happy with that. So we customize a new smile for Tara, and these are the results that we're able to get. Again, we have length appropriate teeth. We have teeth that look natural, right? That look like natural teeth. It doesn't look like she's had cosmetic work done. It looks like she has beautiful teeth.
It's a nice set of teeth.
Absolutely. And you can see she's a very pretty girl, and that smile just accentuates her beauty. She's happier. She looks happier. We've given her the appropriate length, the appropriate shape, the appropriate shades and colors and nuances. You can see again, the teeth follow the natural lip line. Her teeth don't look like they have veneers or crowns on them. They look like she just has a beautiful smile.
Because I feel like I could, I told you, we're here in California, here at the studio, and I feel like I could spot these big giant veneers or fake teeth or even dentures walking down the street. Yeah. You say if it's done right, it doesn't have to be that way.
Absolutely.
So whose idea is that? Are the patients asking for big teeth? Or do you think that's the dentist that maybe doesn't have an eye?
The dentist that doesn't have the eye or the training to be able to point or see these things. And so, again, my goal is to make sure that when anybody walks out, that if you're seen on the street, that somebody says, you have a beautiful smile. Not that you have beautiful crowns or veneers. That's not our goal. And if that ever happened, I would feel like we failed.
Okay, good. So the big boost in the self-esteem, feeling good, eating
Absolutely.
better.
It really, and I'm not exaggerating here at all, it is really life-changing. You can become the person that was really very self-conscious, apprehensive, and I've seen this, you become the life of the party, all just based off of what your self-image is and the confidence that you exude now, because you can do what you wanted to do all along, which is smile.
Now, you do dentures in your practice. Is that right?
Correct.
Okay. So, and you've made a lot of dentures in your career. So what if now that you're doing dental implants, what do you say to a person, maybe one of your past denture patients, they're stumbling onto this interview, what do you say to them?
I'd love to see you again back in the office. We were doing that over a period of time, but we're doing less and less and less of that. I would really love for them to come in, just to even place 2 dental implants where we could secure that denture in, where they could, again, have the ability to chew all the foods that
so
they've
it just
been struggling.
snaps in,
It just
snaps
snaps
out.
in,
Is it locked
snaps
in
out.
pretty tight?
It is locked in pretty tight, yes. You would be amazed at how tight, just even 2 dental implants, what a big difference 2 dental implants can make to secure their denture.
So 4 implants, again, snap in. Is it ever, like, especially if you're 80 years old, is it tough for them to pull it out sometimes? Do you have to adjust it?
Well, there's things that we can do to adjust it to make that easier or more difficult to get out. Obviously, 4 implants are going to be a little bit more difficult to get out than 2, but there's things that we can do to make that easier or harder to get out.
Now, the upper denture, though, is fine, right? I mean, it's got the suction from the roof of the mouth covered.
Fine is in the eye of the beholder. Okay, most people, when they get an upper denture, it's very gaggy. They have a tough time dealing with that. They don't have the ability to chew their food like they once did, and they don't have the ability for sure to taste their food as they once did. So by placing dental implants in there, we can remove the palate out of there, and we can secure that denture in, and we still give them the ability to chew like they once did when they had regular teeth, and the ability to taste their food.
We're out of time. Final message. Somebody watching this, they're in the 2 big groups. They're either headed to dentures or they're currently wearing a denture. They're watching this, and maybe they've even heard what you had to say, but they're still skeptical or afraid. What do you say to them?
Well, I say come in. We can do a free consultation. I can give you what your options are, and then we let you decide. But certainly by just coming in, we're going to make you more aware of what can be done and what can't be done. And then, like I said, Randy, we always let the patient decide.
Now, if there was a test drive period, right? Like I know it's not possible, but you told all the dentures in Wyoming, denture wearers, come in, try a brand new set of teeth that don't come in and out of your mouth for the weekend. On Monday, would anybody be able to go back?
Nobody would be able to go back. Everybody would choose that. I've never had one patient that has went with a dental implant secured denture ever want to go back. And in fact, they refuse to go back.
It's that much different.
Absolutely.
That much better.
Yes.
Okay, good. Well, I want to thank you for coming on the program. You have a free consultation.
Absolutely.
We have to mention Medicare, Medicaid does not cover dental implants, and even the best dental insurance only covers a very small portion.
Yes, but we have lenders out there that can make this affordable to where we can fit this within really anybody's budget.
So financing, you do in your office?
Absolutely, we do.
You just have to have what, decent credit?
Yeah, you have to have decent credit, but there's a lot of different options out there that people are unaware of, and just by coming in the office, we can let them know what their options are, and we can make this affordable for them.
So they are financing these procedures?
A lot of the time, yes.
Okay, good. I want to thank you for coming to the show.
Well,
Good
thank
stuff.
you, yeah.
And if they want to make an appointment, do they get to see you?
Absolutely. You get to see me every single time.
And they go to the website, they can make an appointment there or just call you?
Absolutely.
All right.
Yes. Thank you. Yeah.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.